Okay, going live very shortly with women in self-healing. Oh, perfect.
You should turn it up too.
All right.
Hi.
Hello. Hi. Perfect. I'm putting our info in the chat here so everybody has it. How are you?
I'm fantastic.
I am happy to see your face. I miss seeing your face on a regular basis. So
Yeah. I feel I'm like a weird, like, I don't like, I just woke up from like a coma or something. I'm like,
yeah,
what happened? Like, it's been 2 months. What happened?
I know. And it went like that. I feel like March was the slowest month ever to happen in life, and then April flew.
Yeah. Yeah. I mean, it's May thing now. Like, we're in May.
Yeah,
All right.
I was, looking at something and it said something about June, and I was like, oh, well, that's a ways away. And then I'm like, wait, no, it's May.
20. Yeah.
Yeah, I think we're all in the same boat. But do you want to do just a little intro as to who you are? And I can do the same since we're on each other's accounts and not everybody's familiar.
Sure. I am Sally Hayes. I have been a massage therapist for 21 years now. My background's in clinical sports massage, which is injury assessment, rehabilitation, soft tissue work. I specialize in pregnancy, prenatal, postnatal, infant massage. That's my big genre right now.
Hmm.
I've always done pregnancy massage, but I almost exclusively do it now. So it's my favorite work. I've always liked working with athletes and pregnant women because those are the two groups that are using their body to do an objective. So they're like really focused, like they're doing all the things and they're looking for like relief and they're I don't know. They're just the best client groups in my personal
They're like
opinion.
the compliant patients that really want to do what they need to do.
Yeah.
And they'll respect the professional opinion and they'll be involved in the process of their own health. Um, so I totally get it.
Yeah.
So
I find it
for
valuable.
me,
I think it's important to work with somebody who finds what you do valuable so that you're not
exactly.
you're like working together.
Well,
So
and that's what it should be. Like every patient who comes in my door, it's about empowerment. I don't want you to just feel like the only time you're practicing anything for your health is when you're coming into the office. You should, be involved in that whole process and be, seeking out things outside of the actual treatment to be better. So, yeah. And our professions often, get like linked up and go hand in hand very well. I also really enjoy working with postnatal as a licensed acupuncturist. My specialty is post-surgical, which, really what I love about the post-surgical aspect is just working with trauma and recovery. So that specialty in post-surgical recovery has spanned to injury recovery, to recovery from pregnancy and delivery and, potentially a C-section. But, the body is amazing, absolutely amazing at healing. And, we go through these different phases in life, and due to external situations like what we're going through right now where we have to adapt, and I'm seeing a lot of people who different things are coming up now that COVID is happening. But my focus as a practitioner is to make sure that we're always talking about the root cause and not neglecting underlying health concerns just because there happens to be a pandemic going on. You should still be taking care of yourself during the postpartum period. You should still be taking care of yourself if you have chronic pain. You should still be taking care of yourself if you have stress. And it's not just about immunity at this time. I was just on another call talking about how the immune system is simply just a reflection of what's going on underneath. there's a root cause, and if you're overall healthy, then you will have an overall healthy immune system.
Absolutely. And you are who you are every day. Like this, like, yes, we happen to be faced with a global pandemic. And
Hmm.
also, you're still exactly who you are and you've always been. So it's
Right.
to have your tools. If you had been working with tools up until this point, you have those to grab from. If not, then now's a good time to reach out and find some tools to help you navigate. I think it's an interesting time that we're in. And I don't know, like I kind of linked it to like the birthing process initially. It's very uncomfortable. This is the unknown. We don't know what's happening. That's generally how, labor and birthing happens. And then, after there's recovery and there are all these stages that we have to go through. And yeah, I think it's interesting. Like the most fascinating thing for me about the human body is that it does heal itself. And like we get to witness that and help facilitate it, and it's never lost on me. It's always amazing to me that, like someone can come in with chronic pain and you could do something that helps them like connect the dots or just
Hmm.
that. And yeah, I love it. I love the human body. I think it's fascinating.
It is. I learn something every day. That's why I love what I do. Like, I'm like, I can teach something every day and I can learn something every day because the body is so innately intelligent and wants to heal. And like you said, I'm just like a facilitator. I just use my education to help you push it in the right direction. But it's the body that does that healing. And, but we do need tools. We need tools in our toolbox. And that kind of leads us into what, we're really going to talk about today with what happened with everything getting shut down. I was, fortunate enough to stay open, but many, at a much lower volume. There wasn't a lot of help from governing bodies and regulating agencies as far as like, well, what are the guidelines with this? And it's different in every state. Here in California, I'm fortunate enough to be considered essential healthcare and to be a primary care provider. But I have colleagues, in Florida, in New York, in other states where, they could have really been helping people at this time. And they were not able to stay open. And I know with massage, that's incredibly frustrating because I've always considered massage medical. It's often part of treatment plans for patients that I see. So, what's been your experience with that? How are you still, staying in touch with patients and continuing to provide value right now?
Yeah, it's been really tough. Also governing boards just kind of went silent. Everyone just went silent. We didn't have any directives. There was no stop practicing directives. We strongly recommend you to not work at this time. And then the next thing we hear weeks later is we'll report you to the police if you're working. And it's like, but are we not working? Like we're left out of, like we're never brought in. And then, in some states there, massage therapists are considered allied healthcare workers. So they are working. And, I know like in some professions, like chiropractic can also do massage. So like if the act of massage can be going on, then why are massage therapists not working? Like, are we healthcare or are we not?
Right.
And for me, this has been a really, I think, important time to leverage the massage industry more into healthcare, which is where it should be. After the recession, everything got really cheapened and everybody started looking at massage as just a price point instead of like how valuable it is to the human body. And I think at this point, it's really important like to be healthcare. And I think that our insurance companies and our governing boards should really step up and help guide us into, better hygienic practices and, how we can move forward safely. At some point, we're going to work again. Obviously,
Right.
we're not going to work the same way we were. So where are our directives? What are we doing? Are we wearing masks? Are we not wearing masks? Are we wearing a hazmat suit? Are we doing clothed like shiatsu Thai style massages? What are we doing? And I talked to everyone across the country I could in multiple professions, but especially in Georgia, they went back. So I talked to a lot of massage therapists there. They didn't really feel comfortable or ready to go for the most part to start working again. So when can we work? How can we work? you know, I've come up with my own personal protocol that I feel is safe, and I'm taking some online like hygiene and infectious diseases courses specifically to massage, but I do think that we've kind of been left to navigate it ourselves.
Yeah. And there's such a, in your industry, like my industry, there's such a varying degree of education and experience and the credentialing for that. So it's not always clear. You know, I was in school till I was 30. Like I have a terminal degree in my field. Like I did like 4 years of undergrad, 4-year master's program, 2.5-year doctorate. Not everyone in my field did that same process. And in different states, different things are allowed within the scope. So it gets, you know, confusing when, you know, someone has had acupuncture or experienced Chinese medicine from someone in another country or in a different state, and it may have been a different experience for them. And I think that's part of the process too, because I know you're highly educated in your field and are very medical. And like you said, like after the recession with things getting cheapened and people looking at massages like, oh, it's like this like luxury. I can go in and get a $39.99, you know, massage here. It's not the same thing as what you're doing. And I think, I'm sure that's like part of the frustrating process for you as well, having to educate.
Yeah, I think that's very frustrating. And also, I think this is like a really great time to like, for us as an industry to come together and to make it better. Why do people not want to make it better? Like, why is it,
Yeah.
you know, like, why is that? I don't know. Like, I've always been like, I want to see how I can be better today, you know, like, or not all.
Right.
Um, so, you know, when I went to massage school, I went in Georgia in 1998, and there were 2 massage schools in the whole state. There was no licensing, there was no governing boards. So my school was very, very active about over educating because there was nothing. So they wanted us to be very knowledgeable. Like the majority of my clients had never received massage before. So I had to also become like a salesperson and like
Mm-hmm.
people that it really was a thing, and you know it was important. And back then we had like a national test, and so I took the national test and passed, and it was difficult, and you know, oh great, so we're going to move forward and we're going to fight for licensing and we're going to, you know, get better, and it didn't happen. You know, it you know, it was on the increase, and then you know I think the recession hit and we just were left out of all of the like the fight to become like more medical and more healthcare just got dissolved. So
Yeah.
I'm hoping that this will actually push massage into the light of being seen as valuable and effective. I mean, people are quarantined by themselves in their home without any human touch, without a hug, without, you know, any interaction. I think we're realizing it's very valuable to.
Yeah, I was speaking with an acupuncturist who is also still open right now. I'm practicing here in California. And she was saying, you know, I am using a mask, but I'm not wearing gloves. I'm still washing my hands obsessively, like we always do. She was like, but people are starved for touch right now. And that is a therapeutic modality. And we're forgetting that. You know, you're missing out on that. And, you know, when I studied Chinese medicine, there's so many, you know, we focus a lot on the needle because everybody knows acupuncture, but bodywork is a part of that. Like Chinese medicine, Eastern medicine was a complete medical system, and bodywork is part of that. It's something that, you know, traditionally has been valued. You know, it's been time tested and proven. So that's why in my mind, it's always been healthcare. And I've always, you know, seen it play out in medical settings. So I think you're right that this is a really important time for those discussions, and to come together as different industries to kind of, you know, put some guidelines in place. Because I don't really think it's acceptable that, you know, you're just like left to your own device. Like you're someone who is going to, you know, go ahead and do additional training and, you know, make sure that you have a protocol in place. But what about the majority of your industry that like really needs that help and needs some type of regulating body that's saying, hey, this is what, you know, you need to do. Here's some guidance. Here's some leadership. Oh, did you freeze on me, Sally? I think so. Oh, you lost sound. Okay. What's going on? Can you hear me? Nope.